Hi everybody, thanks again. This is Dr. John Degenhardt. I started these TV shows about 35 years ago called Let's Talk Chiropractic because I felt, and I still feel, people don't know what chiropractors do. Some chiropractors on YouTube are so scary and so rough. Today's show about pregnancy, adjusting infants. I think some mothers out there thinking, oh my God, what's this chiropractor doing? But today we have Nicole Bookman. I welcome her to the show. She just had a beautiful little boy, and she trusts me enough to let me adjust the baby on today's show. So Nicole, welcome to the show.
Thank you.
Thanks for coming.
Of course.
Tell people a little bit about yourself.
My name's Nicole Bookman. I am 24 years old. I'm a CNA, and I did just have my baby, so I'm 6 weeks freshly postpartum.
Okay? And you're going to see on today's show why. Why should a baby be adjusted? People think we're just here for falling on ice and snow. So let's take a little break. We'll come back and we'll explain why. So those women out there that are pregnant or hoping to become pregnant or new mothers, this show is for you. Nicole, pretend you're a pregnant woman watching this show. Some of them are afraid of chiropractors even before they're pregnant, much less after they're pregnant. You came to me while you were pregnant.
Absolutely.
Explain to them why they need to see a chiropractor while you're pregnant.
I think during pregnancy, women experience all types of pain, especially in the back. And when I thought about coming to get pain relief, I knew that I would have to go to a chiropractor. Dr. John has been doing chiropractic on my family for a very long time. And so he was the one that I knew I wanted to go to, and I felt safe.
And I talked about that on last week's show. Not every chiropractor does this, Nicole. A lot of guys out there, to be honest with you, they're big, strong, muscle guys, so they prefer to do athletic, rack 'em and crack 'em, and that's okay. I could do that for the athletes who come here. But this show is special. As your belly got bigger, we have a special table that opened up to give you more room. Because that's the first thing women ask me. Oh, I didn't know the table opens up. Because, how do you have a belly like a watermelon laying on a table? But the table opens up.
Yep, it did.
So while you were pregnant, you felt it was safe and gentle to get adjusted?
Oh, absolutely. I felt safe the entire time. Like he said, that table did open up perfectly for my belly. So there was never a moment where I was feeling tight or anything like that. I knew it was okay.
What I loved is your husband would watch me. We would measure the length of your legs, just like you do in all these other TV shows. But when it's off like a half an inch, make that gentle adjustment, put some ice. She'd come back all smiles. So it's a good natural way.
Absolutely.
When you're pregnant, I guess they used to tell women it's safe to take Tylenol. Do they still say that?
Yes, they do say that. I never wanted to take any medication just because I didn't want anything to be transferred to my baby. But they do tell you that Tylenol is okay in small doses.
And that's why today's show is powerful. When my wife and I had our 5 children, they said to us that the Pitocin epidurals are not going to cover the blood-brain barrier of the baby. Now we showed studies or slides on the last show that it does. So mothers that have Pitocin, which is to force that baby out a little faster, epidurals, which is to numb the woman so she doesn't have too much pain. So I asked these young mothers, look in the eyes of their babies. When a baby almost looks like he's out of it, he is. The medications, which sometimes are needed, I'm not against stuff like that. Sometimes cesareans are needed. Forceps, I'm not one of these guys knocking the medical profession. But I'm saying my prayer for today's show, OBGYNs, try to have a vaginally unassisted birth as much as you can. Young women, what that means is when this beautiful girl is in those stirrups, the head's coming out, for her to talk to her doctor and say, don't pull on the head. Don't use forceps if you don't have to. But if the mother gets tired and Pitocin's needed, if the mother's exhausted and epidurals are needed, I'm not against that, but at least have that discussion. Let's have the ideal birth if we can. Tell people what you told me earlier. Your doctor who started with you, in my day, those private practice doctors, Dr. Vacinas, Dr. Lee, they stayed with you all through the pregnancy, but it's not like that anymore.
Unfortunately not, no. Most of the time you do get an OBGYN and they won't even deliver your baby. So when you do go into labor, you're meeting a doctor that you've never seen before, and it can be a little bit scary.
Because your doctor, again, just a little details, your doctor was a woman who was familiar with your baby's fetal heart rate was always just a little lower.
Yes.
Then she wasn't there. This other doctor comes and says, because the fetal rate is a little lower, let's induce the labor.
Yep.
I guess he felt maybe something was wrong. So you went, what, 2 or 3 weeks early, did you tell me?
Yeah, so I was 37 weeks and 5 days.
Okay. So they gave you Pitocin.
Yes, they did. They started me on Pitocin after a medication to dilate me, and I was on Pitocin for probably around 8 hours. That Pitocin is rough.
My wife always felt out of control. Like the contractions, I can remember on the fetal heart rate monitor, you can, here come the contractions, honey. Let's get rid, okay, they're subsiding. But with Pitocin, it's much stronger.
Yes.
From what she told me.
Yes, they're stronger, they're longer, they're more close together. So it definitely does put you a little bit farther down in labor.
Okay, so a new unknown doctor is there, which is not the ideal situation. Pitocin was necessary. So then the epidural was given.
Yes.
How did that work out for you?
So I managed to make my way to 7 centimeters before I absolutely needed that epidural. I was so exhausted from being in labor, and the pain from the Pitocin just kind of put me in a different mindset. So I got the epidural, and from 7 centimeters, an hour later, I jumped right to 10.
Good. So then the baby came out pretty easily?
Yes, baby came out. 2 pushes. That was unassisted. No forceps, no vacuum, nothing like that. Just straight out, which I'm thankful for.
And this is a beautiful show, because I don't want people thinking, we talked about last show, midwives, dolums, having babies at home. I'm not against that stuff, but we had all 5 of our babies at the hospital, just in case, if there's bleeding or tearing or something could happen,
Absolutely.
So, to be blunt in closing, because of malpractice insurance, and that's the reason why, back in the day, those doctors spent $135,000 on malpractice insurance. Now the doctors will say, I don't want to spend that much, so let me help you through, but let's go to somebody else, because even after the birth, you didn't see your first doctor.
No, I did not.
Okay, so far so good. So open your mind, young ladies. That's what's going to happen as far as your doctor won't be there at the end. Hopefully you know that. Let's take a break. Come back for the second session. Thank you again for spending time with us. I respect your time. I hope you're saying to yourself, this is really a special show. This beautiful young mother who's busy doing, I remember those days, get the chores done when the baby's napping. So she took time out of her busy day to come up with her little guy. So he's what, 6 weeks old, did you say?
Yes, he's 6 weeks now.
Good. I want to get in your shoes. I think one of the reasons we're the busiest office is I try to connect. I try to love and listen, again, in the shoes of every patient. She connected for a couple of years, you said, with your OBGYN. And at the 3 months into it, the first trimester, she says to you, oh, by the way, I'm not going to be there for the birth. I'm sure you were like, could you tell me that sooner?
Yeah.
So I am here for all these 45 years, hopefully for many years to come. But I want these girls to understand that their doctor might not be there. Do any doctors go through the whole process now?
There are some private practices still. They are few between. I mean, it's hard to find them. But if you do, that's the way to go, for sure.
And try to keep that connection. Like
Yes.
you felt good with this girl for 3 years.
Absolutely.
And then all of a sudden, she's gone.
Yep.
Yeah, so the communication probably could have been better.
Yeah.
Okay? But pretend there's young mothers out there. Their babies right now cannot suck on their nipples because maybe they had a difficult birth. So again, we talked about on last week's show, a misaligned spine can pinch the nerve to the frenulum where they're tongue-tied and the baby cannot suck properly. Or later, 6 months from now, they start getting ear infections from pinched nerves in their neck going to their ear. So these young mothers watching the show are saying, okay, I learned more about the birth process, but now I do. I have a 3-month-old baby and I could tell something's not right. He's gassy. he's crying all the time, and the pediatrician just says, oh, he'll outgrow it. I never even considered chiropractic, but now I'm nervous watching this show. How did you feel? What would you say to those mothers when you first brought this little guy? From your heart, what would you say to them?
Well, unfortunately, I'm going through the same situation. My son is very gassy. He had a trouble latching, so I wasn't able to fully breastfeed. I knew I needed something to get him on the right path, so I did some research. And knowing that Dr. John does such a good job on me already, I was not scared at all to have my son come here and for him to look at him. Last week when we came and he did his little adjustment, it was not scary at all. I mean, I put my full faith in him to hold my child and adjust his little neck just by a little bit of pressure. And I would tell you guys to do the same thing, because just in this past week, I have noticed it's slight, but there is a big difference just from not being able to latch on properly to he's starting to be able to. So it was worth it.
And again, listen to her story now. The baby came out easily, but prior to that, there was Pitocin, there was epidurals. So there was maybe some harder contractions on that baby's head as the baby comes through your body. So again, I am not putting down the medical profession. I'm not putting down OBGYNs. I'm trying to empower mothers and grandmothers to say, a specially trained chiropractor, and you're going to see in 2 minutes, she's going to hold this beautiful boy against her chest. We have a special instrument that simply monitors the temperature. So on the colder side, all I do is a pressure point. I have had doctors approach me, like I'd say at a country club Christmas party. Do you crack babies' necks? And I said no. But I told the story last time. I had this nurse. She was so angry when she saw a show like this years ago. She called me. You chiropractors, you think you could heal everything. She calls me. Her baby had 5 ear infections. He was about maybe a year old. Again, pediatricians kept saying multiple antibiotics, the baby's going to outgrow it. She got fed up after 5 ear infections.
Yeah.
So we did what we're going to do now. We did a graph reading, a pressure point, no more ear infections. I didn't see her for years. She calls me. Her son is now practicing for 20 years as a chiropractor in the state of New York.
Oh my
So
gosh.
what a beautiful, when I think I'm getting older, it's beautiful to see the impact we can make on people's lives. So you young mothers, don't take my word. This is her word. A beautiful young mother. She's only 24.
Yeah.
But she trusted me. And you're going to see, I'm not going to crack your baby's neck. But we talked about the stresses involved, even with a normal birth.
Yeah.
You know, the average, you were in labor for how many hours total then? Do you remember?
It was around 18.
Okay.
Yeah.
That's a long time.
Yeah, it was.
I told my wife about this show. You know, and that's why I'm being honest with you. My wife had 3 children naturally. She was 40 years old with our 4th and 5th children, 41. She won an epidural. She just felt at that point in her life, the nurses even said, you deserve it. You should have less pain, but she didn't have Pitocin.
Yeah.
So, but now that I realize there is that blood-brain barrier, I'm the compromiser. I would have said, honey, it's your body. If you need the epidural, do it. Let me just check this baby afterwards.
Yeah.
Okay, so I know this show probably challenged some of your ideas, and that's okay. That's why I'm still doing this show. So we do big old athletes, more aggressive. We do pregnant women, more gentle. We do infants, even more gentle. So if your child, again, look in their eyes. If the eyes of a baby, and I'm talking 1 day old, 5 days old, if they just seem like they're out of it, like they're not focusing, something's not right. And your OBGYN, your pediatrician is not going to talk to you. When I hold a baby, I want to feel a oneness, Nicole, with the baby. Like there's a relaxation, and we call it a tone. The tone of the baby should be calm. If the baby is rigid and gassy and crying and not sleeping, your baby's subluxated. Your baby needs to be checked by a chiropractor. So we have to close for the show, for this segment, but we're going to go down to the adjustment room. This is the beautiful part of the show. You're going to see what a full head of hair this little guy has. And we're going to check the baby just like I did for the first time. Was it last week?
Yes.
Yeah. Okay, so let's take a break. Let's see what a baby adjustment is like. This is a beautiful show, and this is the best part of the show. This beautiful baby that the Lord has given them. Remember, Pitocin, epidural, but a nice, easy delivery. So we're going to talk about, we have a special machine where I take a temperature reading like we did for the first time. She felt that her baby was gassy, crying, maybe not sleeping as well. If I had a dream, every single child that is born would get a chiropractic, at least an analysis. I really think so.
Absolutely.
They do that APGAR score when a
Yep.
baby's first born. But briefly, things have changed over the years. You had, would you call it a baby plan?
A birth plan.
Tell people about that.
Yes, so I had my birth plan, which essentially just put how I wanted my labor to progress. I didn't want many medical interventions. I kind of just wanted it to be a peaceful environment, and that's exactly what the hospital gave me. So I'm grateful for that.
And my point is, you seem like you planned ahead.
Yeah.
Not every girl, I bet you, does a birth plan. Yeah, so I want you girls to learn from this show. Again, this is for these girls that are 3 months pregnant or are going to have another baby. A birth plan is developed how?
So essentially, I did a lot of research throughout the months of me being pregnant. And I compiled all the knowledge from other mothers on the internet and added it into my own birth plan to give to the nurses and the doctors.
Okay. So we say chiropractically, the more natural you can stay, no forceps, no vacuum machines, things like that, the better. So her birth plan hopefully is communicated to the doctor, which we learned in today's show might not be the same doctor you start with, but whoever's going to be the birthing doctor, that doctor needs to be understood of the birth plan.
Yes.
Okay? This is called the DTG. So there's the temperature of my skin, 87 degrees, but it puts it onto a graph. All we feel as chiropractors is if this beautiful baby, and I hear you want to be part of the show, don't you? He's saying, let me sleep longer. The atlas vertebrae is the main vertebrae which is next to the occiput that is misaligned from the Pitocin causing bigger pushes or the epidural where her body's more numb. All I do is take a graph reading on each side of the atlas. On the one side that's colder, I hold a pressure point. It might take a couple visits. Like she said, it's a process. Well, eventually the baby's nervous system, God created your babies to adapt to its environment. I am not here to fix your baby's pinched nerve for their frenulum or pinched nerve for their ear infections. I'm here to help the baby's nervous system to adapt to its environment. Maybe that means less gas. Maybe that means better sleep. I'm just here to give a better nervous system to your child. So that's what this machine is. So let's start on the right side first. Okay, just hold still. Okay, we'll do the left side first. He wants people to see him on the camera.
Yeah, right.
Now we'll come around. I hold the baby's head just to make sure I get the right exact spot. Sorry. So I'm going to show this on TV quick if we could. Same thing about though. So I don't know how much you could see this right on TV, but there's about a 1 degree difference, which means the baby's atlas is still subluxated. So my job is to get those temperature readings to be as equal as we could. So let's put a pressure point. And again, you have a good voice. Screaming. You must get that from your mother's side of the family. So all I'm doing, I'm finding there's an occipital ridge. I'm holding a little pressure point, and I have to move my finger as this little guy moves. This is just for the neck. There are sometimes if a woman has a baby born feet first, we have the baby on top of you, and even though their legs are bent, we measure the length of their legs.
Right.
But in this case, we're doing just the atlas. So you hold his head. Okay. Let's take another reading. Again, we'll do this side first. Okay, buddy. So I'm sure to many doctors or nurses watching this show, or even young mothers, they're going to say, never saw this before. I want Ryan to be able to see the difference. Much better this time. So just to show you, Nicole, here's the first one. You can see the temperatures,
Yep.
like a degree difference. See them?
God bless you.
God bless you, little guy. Another one?
Oh,
Yep.
God bless
Most-
you, my love.
Look at the second one. Finally.
Oh, wow.
Perfectly equal.
Yes.
So again, I don't know if Ryan could see it on TV. It's sort of faint. So all we're saying, you have to trust Megas here. She's the witness
Yes.
that a temperature reading showed that the one side was a degree colder. You watched the adjustment. I did not crack this
I
little
know,
boy's
baby.
neck. It's totally safe if there's pediatricians or gynecologists watching this show. Young mothers, all I did, again, 40 years experience, thousands of baby adjustments. All I feel is like a puffiness. You put a pressure point, and then I take another reading. It's done. It's a 5-second adjustment. So now the prayer is, remember, this little guy should not sleep on his stomach because he has to twist his neck to breathe. He'll subluxate his neck.
Yeah.
Try like even in a car seat. We tell people back in my day, they didn't have these like U-shaped neck supports.
Yeah.
I used to see these
Bless
girls,
you, my love.
you know, the baby would be like in a car seat asleep like this. So I want the mothers and the doctors to become more alert of the position of the baby's head. We all know that the baby's head flops around so much, but as chiropractors feel that during birth is when the baby's neck is what we call subluxated. So if you want your baby to have a better nervous system, to adapt to this world better, see a specially trained chiropractor who can adjust the baby. So thank you so much, Nicole.
Of course.
Our prayer is that this has empowered many mothers and nurses to have a baby plan
Yes.
and a nice gentle birth. Help your baby to adapt to this world. Thank you.